Are you struggling with weight gain, slow metabolism और क्या हमेशा थकान और फ्रस्ट्रेशन महसूस हो रही है? और क्या अगर आपने कभी ऐसा सोचा है कि अच्छे से डाइट और एक्सरसाइज फॉलो करने के बावजूद मेरा वजन क्यों कम नहीं हो रहा है? तो हो सकता है कि आपका थायराइड ही इसकी असली वजह हो। So namaste and welcome everyone to another episode of Beyond the Pill where health meets conversation. I am your host Dr. Chetna, and in today's episode we will burst the myths about thyroid and obesity. So to decode and simplify this, joining us today is Dr. Sagarika Mukherjee, a renowned endocrinologist practicing in Kolkata with her expertise in thyroid disorder, lipid disorder, pregnancy-induced diabetes, and as well obesity. So let's give her a warm welcome and understand the relation between thyroid and obesity. So, firstly, hello, ma'am, and thank you so much for being a part of our show today and थोड़ा टाइम निकाल के हमारे शो पे आने के लिए, that is Beyond the Pill. So how are you today?
Who will be again
Yes.
logging in and listening to
Yes,
this show.
yes.
So it's definitely an honor to be called here.
So our motive is to spread awareness through such programs, and we felt that you would be like a perfect guest for us, who would help us to spread awareness about obesity and as well thyroid. So, ma'am, let's just understand first what exactly is endocrinology as a field, because most of them doesn't even know the field and what type of doctor to visit when they have such metabolic disorders.
Okay. Endocrinology is the field of medicine which deals with hormones. The bulk of endocrinology practice is, of course, diabetes. Diabetes deals with a hormone called insulin, which comes from a gland called pancreas, which is situated right in the middle of your abdomen. The other hormonal problems which we tend to deal with, or endocrinologists deal with, are like thyroid disorders, pituitary gland disorder. Pituitary is a tiny little gland which sits on the base of your brain, where women wear the bindi. If you put a pin and if the pin points straight ahead, and there is a gland which hits called the pituitary gland, which sits at the base of the brain. And that's like the master endocrine organ, or the master gland, which secretes a lot of hormones which control the other endocrine glands.
Understood.
There are other endocrine problems where people have problems with adrenal gland, which is again tiny little glands which sit on top of your kidneys. And then there are problems with prolactin related issue, which is again a pituitary problem. Problems related with obesity, certain kinds of hypertension or high blood pressure, parathyroid glands, which are tiny glands situated on top of on the four corners of your thyroid gland in the neck.
Okay.
So there are a lot of glands in the body, or endocrine glands which secrete hormones. And endocrinologists deal with these hormone related disorders. And again, bulk of endocrinology is diabetes.
Okay. So what made you choose this field, and before that, how has your journey as a doctor been?
Right. Very interesting question. What made me choose this field was when I was a junior doctor, I got trained in the UK. That again was because of the sheer luck. I got married to a person who was already in UK. So I got to follow his steps and went to UK. I trained as a junior doctor. And then when it was time to choose specialty, I chose for endocrinology. First and foremost, it is a very clean specialty in the sense that it doesn't have anything invasive to do with it. There are a lot of, you have to do a lot of studying behind it. So there are a lot of academics involved with it. There are a lot of, it's related to the other specialties in the body, like it's a lot related to cardiology, a lot related to the brain. So you can connect base with the other specialties as well. And as I got training, or as I got into endocrinology as a junior doctor, initially as a registrar and then practiced as a consultant, I became more and more interested.
Okay.
And now I just practice as a super specialist endocrinologist.
Only in Kolkata?
Only in Kolkata, yeah.
Okay. And did you you had this dream of becoming a doctor always since childhood?
That's also interesting. Yes, yes and no. I thought about becoming a doctor, but was not very steadfast of choosing the specialty. I was rather inclined in physics and mathematics as when I was a student in my teens.
Surprising.
Yes, was very much keen on physics and mathematics and wanted to become an astrophysicist and wanted to work in NASA, big dreams, big dreams. But my dad was a steadfast follower of a doctor, and he wanted that I should become a doctor.
Okay.
So he just loved the medical profession and he wanted really me to become a doctor. And then he very slowly nudged and pushed and pushed. I thought I won't get through joint entrance. But again, I got through it and then become a doctor.
So if not a doctor, you would have been an
I would have become an
astronaut.
astronaut, astrophysicist at least.
Okay. I mean, that the combination is like really bizarre. Okay, so now, I mean, you're a beautiful person sitting here, and I am sure that through your talk, our audience will get a lot of clarity. So, our today, like your expertise in thyroid disorder and obesity, so that's why our today's topic is the relation between thyroid disorder and obesity. So to start with, let's just understand in simple terms that what exactly is thyroid.
Right. Thyroid is a endocrine gland, and thyroid is a gland. It looks like a butterfly. It sits on the middle of your neck like a butterfly. There are two lobes of the thyroid, or two parts of the thyroid, like the wings of the butterfly. And there is a middle part called the isthmus, which connects the two lobes of the thyroid in the middle part of the middle part of your neck. So this is the thyroid gland. So thyroid gland secretes an active hormone, which is called thyroxine. And this thyroxine plays a very, very important role in controlling the metabolism in our body. Like the way we produce the food we eat, the food get metabolized in the body, or get breaks down and becomes small tiny parts, and the entire body utilizes those parts for making energy. The ultimate fate of metabolism is energy.
Okay.
So giving energy for us, say for example, I'm talking to you, we are sitting here, I have to travel and come here. So all these things, and for your day-to-day living, you need energy. So thyroid hormone plays a very, very crucial role in metabolism or providing energy to the body.
Understood. Okay.
So whenever there is a disbalance in your thyroid hormone production, it can either go up, called overproduction, when you have got a term called hyperthyroidism, or it can go under, or underproduction, or hypothyroidism. The main thing which gets affected is the metabolism of it. Right. The hormone produced by thyroid gland is called thyroxine. The hormone is produced by the gland, and there is a controlling hormone which comes from the pituitary gland, which I was mentioning just earlier on, called the thyroid stimulating hormone.
Okay.
The thyroid stimulating hormone comes from the pituitary gland, stimulates the thyroid gland to produce thyroid hormone.
Understood. Okay.
So when there is an underproduction of the hormone, when there is less production of thyroid hormone, the pituitary gland stimulated, and then the thyroid stimulating hormone production from the pituitary gland increases, so that it can boost up the thyroid to increase the thyroid hormone production.
Okay.
So the TSH level goes up, or the thyroid stimulating hormone.
Okay.
When there is an overproduction of thyroid hormone from the thyroid gland, the pituitary gland signals, oh, there is an excess of hormone, so I have to dampen it down. So the TSH production from the pituitary comes down, and it tries to control the overproduction of thyroid hormone.
Understood.
So depending on the amount of thyroid hormone production, whether it is over or whether it is under, so overproduction is hyperthyroidism, underproduction is called hypothyroidism.
Understood. Okay.
And there are a variety of reasons why people get hypo and why people get hyperthyroidism, of which hypothyroidism is quite common, more commoner than hyperthyroidism. We tend to see mostly hypothyroidism in our clinical practice mostly, but hyperthyroidism is also not that rare. You do get to see hyperthyroid as well.
Okay. So now also, just to understand that, what is this connection between thyroid and obesity? Because any obese person you see, or any unexplained weight gain happening to someone, so family members have this thing that maybe you have got thyroid. So what exactly is this mechanism?
Okay. Obesity is definitely on the rise. Even if you look at pictures 10, 15 years ago, we did not have so much of obese people in our part of the world, but now obesity is exponentially increasing. And sad part is obesity, yes, is a condition of your body. And it leads to a lot of other disorders of the body, like diseases connected to the heart, diabetes, arthritis, and a lot of other conditions are caused by obesity. But because this is a condition, it's getting accepted by our society as well. Even there is a fashion line for obese people, so that they can fit into the fashion thing as well. But sad enough, obesity is increasing. One of the main reasons why obesity is increasing is part of our diet.
Yes,
our diet is undergoing a lot of changes. We tend to consume a lot of energy-giving food, a lot of plain or simple carbohydrates. We tend to consume a lot of fat. We tend to consume a lot of readily available food, processed food, which gives rise to obesity. And also our physical labor has gone down.
Yes.
Say my grandmother, when she was cooking in the kitchen, she would actually she would actually, to have the masalas for cooking or the spices for cooking,
Yes,
she would
yes.
actually grind them
Yes,
with her
yes.
hand. But now we have the mixie.
Correct.
When first television came to our house, we had to get up from the couch to either on, off, or change the channel
I
of the television.
understand,
But
yes.
now you can operate with a remote.
Even the mobile.
Even with the mobile, yes. So our physical energy expenditure has drastically
Yes,
gone down.
Yes.
Along with it, our food intake has gone up.
Yes.
So that is one of the reasons why obesity is increasing. And also, we as a race, Southeast Asian, we have a very, very funny gene. We carry a very funny gene in our blood called thrifty gene. And that thrifty gene tends to make us more obese when we have an excess amount of energy, when we take energy giving food.
Okay.
If you give a similar kind of food to a Caucasian or a Western population or us, we tend to gain more amount of weight in comparison to the West.
Yes. Just
so
like
that
cholesterol.
is again that is part of the
Yes,
of our
yes.
genetic makeup as well. When we gain a condition, we always like to have something in the back of the mind. Oh, I'm becoming obese because I've got this.
Yes,
I'm becoming obese
yes,
because I've got
yes,
thyroid.
that is true.
I'm becoming obese because I don't have a swimming facility. I'm becoming obese because I don't have a park to run
Correct,
around. Okay?
correct.
So we don't tend to think about the food that we are eating. We then tend to think about the simple activities like climbing upstairs, walking to the market, which may be 1
Yes,
kilometer away
yes,
from your house. We don't tend to do all these
Understood,
simple
yeah,
things.
yeah.
And yet we like to put a blame factor just to satisfy ourselves in the back of the mind. So whenever someone is getting obese, due to whatever reason, they first think of, is it the thyroid problem that I'm getting obese? So doing a blood test is very easy nowadays.
Yes,
You give a phone call,
yes.
from any laboratory person comes to your house,
Yes.
and you have a blood
That
test
is-
and your diagnosis is done. But yes, thyroid problem can cause obesity, especially hypothyroid can give rise to obesity. But the degree of hypothyroidism, which gives rise to noticeable obesity, is quite large, and that degree of hypothyroidism nowadays it's difficult to find, again because of more awareness, better diagnostic
That is a
facilities,
good thing,
better
yes.
access to diagnostic facilities. These things have become, we don't tend to see a very, very florid hypothyroid. We tend to see either quite early or in the middle, maybe they have started 2 or 3 years later. So that doesn't explain the huge or exponential amount of weight gain that people tend to have.
That's what I mean. I just had a relative at home and I met them after like few months. So I told them that you have put on a lot of weight. So the guest told me that I have hypothyroidism. That's why. But I'll tell you, next 2-3 days they were at my place and I saw his diet. It's like, I don't think it's hypothyroidism which you are blaming. It's really your diet and you need to work on it.
Yeah, and hyperthyroidism on the other hand, you tend to lose a lot of weight.
Yes.
The main reason is because, as I told, that thyroid controls your metabolism. So when you have hypothyroidism, your metabolism becomes very slow. So you produce less amount of energy, and the food that you take is not burnt out properly. So as a result of that, you gain a lot of fat and you become obese. Hyperthyroidism, on the other hand, there is excess amount of thyroid hormone. So your metabolic rate goes up, you're burning a lot of calories, and you tend to lose weight even if you're eating normal food.
Okay, so it's not that way ki if you're really having a healthy diet and healthy lifestyle, and still if you have thyroid, so I don't think that is the case ki thyroid will still lead to weight gain. Is it that way?
Can, but it's more or less manageable, and you can make out that this is thyroid related weight gain and this is obesity related to food or lack of activities.
So because thyroid has symptoms which are like very common, like I don't think that people would really think that I might have a thyroid disorder. The symptoms are like dryness in the skin, or sudden weight gain is also just like 1-2 kgs. So how do one come to know that I might have a possibility of hypothyroidism?
Yeah, you need to have a bent of your mind to think that I can get a thyroid disorder. One tends to feel a bit tired, always down. Even if you wake up in the morning, early morning, you tend to feel tired at that time. You gain a certain amount of weight, you're feeling very lethargic, your mood is down, you get dry skin, you become a bit slow in your activities. So these kind of things come. And you really need to have a bent of mind to go on your own to have a test. Or with these kind of symptoms, if you visit your doctor will order for a thyroid function test, and then the diagnosis is made. And usually the blood tests are quite easy to do. You got a TSH done or thyroid stimulating hormone. That determines whether you are underactive or overactive.
Okay.
If you have an overactive thyroid situation, then your TSH is low. And if you have an underactive thyroid situation, your TSH level is high.
Okay.
And then the doctor orders other tests like doing your free thyroxine or FT3, and then your diagnosis is made.
Understood. So if someone is obese and if you are treating your thyroid, so can it help to reduce those extra pounds?
If your obesity is directly related to hypothyroidism alone, then treating thyroidism definitely helps to lose weight, but alongside with it, you have to also pay attention to your diet and also incorporate vigorous physical exercise.
Okay, okay.
Okay.
When you, I mean, I'm sure that patients who come to the clinic, they must be coming with the blood test only. Now that awareness is
Now
really
there is a lot of
high.
awareness. The social media plays a huge
Yes,
role in creating
yes,
awareness. There are a lot of messages from other people who are already suffering from thyroid dysfunction, that I've got this, I've done this blood test. A lot of people read about it, share news. There are some specialized platforms on the social media who talk about health issues. So awareness is definitely around. And because of this increased awareness, which is again good that people are becoming health conscious, you do a test to diagnose a condition. So when your condition is diagnosed, if you have a thyroid issue, definitely go to your doctor and you start off on medication. Your doctor will prescribe you medication. The dosage of the medication is determined according, your doctor will determine your dose of medication, and then you stay on it.
Okay. So who is actually at risk of developing this thyroid? Is it genetic?
Sometimes it is genetic. If you genetic means you carry, there is an abnormal protein which is created in your blood called anti-thyroid peroxidase antibody or anti-microsomal antibody. This is an abnormal protein which gets created in your blood. Why this abnormal protein gets created, no one knows. It's nature's choice. And this abnormal protein is called an antibody, anti-TP or anti-thyroid peroxidase antibody. This stays in your blood and you can actually pass this on genetically. A mother can pass this on to the child. So it can be genetic. It can be sporadic. You can develop an antibody by itself. So that can be sporadic. If you have an operation of your thyroid gland, you can become hypothyroid.
Understood.
If you have a radiation of your thyroid gland due to any other reason, you can become hypothyroid.
Okay. So understanding the screening part of it, like, do you need like a fasting period before getting your thyroid levels checked?
Usually it's at the morning blood test is done. You just need an overnight fasting, but nothing didactic like that.
And how frequently you're supposed to do the testing?
Okay, that depends what level of thyroid dysfunction you are being diagnosed. If you have a gross thyroid dysfunction, say hypothyroid we are talking about, your doctor starts you on thyroid replacement therapy. Usually you have to give about say 8 to 10 weeks time before you do the next test, because thyroid is a very long-acting hormone. You can't have changes in the thyroid hormone level overnight or even within a few days. So you need to give them a few weeks for that hormone the medication to settle down in your body and play some role and then alter the thyroid function. So you have to give about 8 to 10 weeks time before you order the next test. And then your doctor alters your medication level. After your medication level is altered, he will again tell you to come back after about say 10 to 12 weeks time, alter the medication again. And once you're on a stable dose, which usually takes about 5 to 6 months time to achieve a stable dose, you stay on that stable dose and then you get a blood test done either twice or at least once a year. So if you are wanting to do it just once a year blood test, I advise my patients to do a blood test around their birthday so that they don't forget about it. They won't forget about their birthday. So if you tend to do it just before your birthday or after your birthday, then you won't forget to do your yearly blood tests.
Yes, that's a good idea, I feel. And then coming to the treatment part of it, what is the treatment that is available for treating hypothyroidism?
Okay, hypothyroidism is very easy. There is only one pill available called thyroxine. There are different brand names of the thyroxine pill which is available in the market. You take whatever your doctor is prescribing it. The prescription rule is we start with a low dose, because especially if you're going to start thyroid hormone prescribing in elderly person, because when you give thyroid hormone, it has an impact on your metabolism. So if your metabolic rate goes up, that creates a little bit of pressure on the heart. So your heart rate and heart condition can get worse. So we tend to prescribe it at a low dose and progressively increase the dose. and depending on the level of the TSH, depending on the level of the FT4, the dosage get adjusted. Your doctor tends to adjust your dose.
Okay. Okay.
You or me may be on the same dose of thyroxine, but our metabolic rate is quite different.
Okay.
I may need changing the thyroid dosage maybe every 3 to 4 months.
Okay.
You may not need changing even year after year after year.
Understood.
So that doesn't mean because you and me are on the same dose that I won't visit my doctor and you will go to visit your doctor every year. It's not like that.
Okay.
So do visit your doctor whenever the time specified is, because at that time your doctor has thought about it to change your thyroid hormone dosage or may require a dosage change.
So once you start taking this medication, so you have to continue lifelong.
Yes, if your anti-TPO antibody, which I was just mentioning, anti-thyroid peroxidase antibody, is positive, which means your thyroid dysfunction or underactive thyroid is caused by this abnormal antibody, and your thyroid gland dysfunction is permanent, or it's not going to recover. So you need to take the thyroid pill for the rest of your life.
Okay.
It's just like wearing glasses. Some people have to wear glasses for the rest of their life.
Understand.
They don't have to think about
Yes.
it. So popping a pill, immediately you get up in the morning. That's easy as that.
Exactly.
And you do a blood test
Exactly.
every 6 months or at least once a year.
It's easy to manage.
And the pill
thyroid.
is a small pill. It doesn't cause a lot of interaction with the other medications that you're going to take. And it's very easy.
So when is the right time to take
the right time to take thyroid hormone, the thyroid pill, is early in the morning. The first thing you do when you get up early in the morning, take your thyroid pill, wait for about 30 to 40 minutes before you take your drink, either a tea or a coffee or any other medication. Now, over-the-counter medicine, taking over-the-counter medicine is very common in our country.
Yes.
Especially medications for digestion,
Yes.
You have a bloating,
Yes,
you go to a party, you have a bloating, or you always feel I've got some acidity. You go to your local chemist and have a drug over the counter, and a lot of them tend to prescribe drugs called PPI, proton pump inhibitor. These are just given
Yes.
willy-nilly over the counter, not even with a prescription. And these medications are also supposed to be taken early in the morning. And people who are taking thyroid pills, they take the thyroid medication and the medication for digestion together early in the morning.
This is a common mistake they
Very,
do.
very common
Okay.
thing happens. What happens when you take the digestion pill? It lowers down the acid in your stomach. The thyroid pill requires a little bit of acid in your stomach for its full absorption and
Okay.
metabolism.
Okay.
So then your
Okay.
acid is gone. The thyroid pill, what happens?
Understood.
Your thyroid pill is not absorbed
Correct.
properly.
Correct.
As a result, your thyroid function, it will show up on your thyroid function test. So if you have to take your thyroid pill, take it the first thing in the morning, wait for 30 to 40 minutes, then take your digestion pill if at all you have to take it. And then after about 20 minutes or so, then go and take your tea.
Yeah, I think this is like an important message that needs to go out to the public because they do this mistake.
Yes. This is a very common mistake.
Yes, and also that not many people are there to the medicines. Like they avoid taking
people are
it
not.
every
Yes,
day.
people are not aware of it, and many people think if you forget it the first thing in the morning, you can take it whenever you want to. Yes, once in a while you can, but if you have a habit of forgetting, this mainly happens for very, very busy people. You're a busy executive, you're a busy businessman, or maybe you're a homemaker and too busy with the kids and too busy with the family life, and you don't pay heed to yourself and you tend to forget.
Yeah.
What I suggest is everyone has got a mobile phone now. Put an alarm on your mobile,
Correct.
and the minute the alarm rings, you take your pill.
Yes, that's again a good idea. And also they need to understand that what can happen if this hypothyroidism goes untreated.
Yes, if your hypothyroidism goes untreated, it can lead to a lot of other conditions. Couple of weeks back, a gentleman came to see me that he was feeling very low. His skin was becoming extremely rough and gritty, rough to the extent that it was gritty. He feels extremely tired. His features are changing. He looks more puffy. People are commenting on him. So again, he talked about with his relatives, and the relatives had advised, do a thyroid function test.
Yes.
You don't need a doctor's prescription. You can walk up to a
Yes,
lab and you have a
yes.
test. So he had this test, and his TSH level was exponentially high, very, very high. So what happens? So he left himself untreated maybe a year or two before arriving at this level, only because he was not aware of the condition or not paying attention. He was thinking he's under the weather, having a viral infection, or it's overworked, that I am feeling very tired of it. So you tend to feel very extremely tired, low, drowsy. And if you leave your thyroid untreated, especially underactive thyroid or hypothyroid untreated, it leads to problems with your heart. Your heart rate can slow down. You develop a lot of fluid inside your body. You can develop fluid around your heart, inside your abdomen. Your nervous system slows down. So a lot of other these kind of
This
things
can
can happen.
Actually, it's like a very small, I mean,
Because your entire metabolism of the body, the
yes,
metabolism of
yes,
each and every
yes.
organ of your body gets
Understood,
affected when your
understood,
thyroid is not functioning.
So now coming to like the lifestyle management part of it, what necessary steps do one need to take to manage the thyroid, especially obesity as well?
Okay, you have to segregate thyroid and obesity. These are two different parts. Okay? Although hypothyroid can cause a little bit of weight gain, but when thyroid is already properly treated, it doesn't cause really a lot of obesity.
Because there are
thyroid lifestyle was all you need to do is take the pill first thing in the morning, wait for 30 to 40 minutes before you have any food, drink, or other medication, and that's it.
Okay.
You need to do your blood test whenever your doctor has asked you to do, either 6 months or a yearly, or even a bit earlier if your levels are not that stable. And do your blood test, get your dosage change, and stay on it. This is the thyroid part. Obesity part, first and foremost, it has to really, it has to come to you that I need to get rid of the obesity.
Understood.
It's not like people pinpointing to you. It's not like friends pulling your leg. It's not like relatives commenting whenever you're walking to someone, or not like the street passerby or neighbors commenting that you're gaining weight. The obesity thing has to sink inside you. You really need to have a drive that I need to lose weight.
Yes.
To make myself well.
Yes.
I want to see myself like this. Okay. And having food is a comfort. Food is the best thing. One of the best things we can have in life, because food makes us thrive. Food makes us happy.
That is true.
Yes, food does make you happy. And now you have such a lot of fancy food, say for example, biryani, which really makes a lot of people happy. So you have to first of all think about it. And consuming food should be balanced according to your activity. If you have a lot of physical activity, yes, you need energy giving food like fat and carbohydrates. If you do not have that amount of physical activity, if your job is a lot sedentary job or sitting on the chair, not moving about too much, you do not need so much of energy giving food. So your carbohydrate and fat content in your food should come down. Okay. Alongside with it, you can never ever lose weight until and unless you go on a negative calorie balance. What does negative calorie balance means? You have to have your calorie consumption or the amount of food that you're taking much lower than what is required for your day-to-day activities.
Understood.
And in order to heighten up your activities or heighten up your calorie burning, you need to participate in some form of activity. If you cannot do any sport, just go out for walking. Whatever you can walk, whatever speed you can walk.
Yes.
Now, someone who hasn't walked at all, if you ask them to walk for 1 hour the next day, for tomorrow, they won't be able to do it.
Yeah.
So you can barely walk. An obese person, 5 or 7 minutes, at best 10 minutes. But end of the week, that 10 minutes is going to become 12 to 15 minutes. Yes. End of the month, half an hour. End of 2 months, jolly well, you'll be able to walk 1 hour. And even if you lose, say, 3-4 kilos, you'll feel happy. And then you will feel like,
motivated,
and of course, but food, again, as I said, food gives you a lot of happiness. Need to have a treat for yourself sometimes, but don't binge treat.
Understood.
Whenever you're binge eating, then you tend to gain a lot of more calories and it piles up on your body.
So, it happens that people complain that I am following proper diet, I am exercising. Still, why am I not able to lose weight?
Yeah, people are not able to lose weight if they're following diet. First and foremost, how sincere you are with your diet. Are you really strictly following whatever your dietitian has told you to follow? Yesterday, I met a person in my clinic. She comes to see me. I've been seeing her for quite a long time. Doesn't come on proper intervals. Tend to come at very long intervals. Blood sugar is really not very under control. So I asked her about indulgence on sweets and things, and she said that, I have to indulge on sweets. There are so much of tewhars going on, and I have to indulge on
guilty
sweets.
pleasure.
And it's a custom to have things, and you're not really spending a lot of energy. So tend to consume low calorie meals.
Yeah.
Low calorie meals.
That's a good hack,
the way to lose weight is low calorie meals at short intervals. If you tend to give very long gaps between meals, you tend to gain a lot of weight.
Oh.
Because your body thinks, when you're giving a long gap, your body thinks, oh, I'm not getting any energy, I'm not getting energy. So the minute you get energy, the body thinks, I have to store this, because if I go into starvation, I have to use this.
Okay.
But you never go into starvation.
Yes.
You're piling and piling and piling.
Yes. So that's why I think the intermittent.
So small meals at short intervals picks up your metabolic rate, fastens up your metabolic rate, and you tend to lose a lot of weight.
These are like the good hacks we are getting from you to help obese patients. So also, I'm sure that you must be getting patients with a lot of misconception about obesity and thyroid.
Yes, as I said, that we always like a blame factor, to give us satisfaction that I've got thyroid, so I'm obese. I don't have a park, so I'm obese. I don't have a gym in my neighborhood, I'm obese. So we always like a blame factor to satisfy ourselves. So it's not always the thyroid. Watch out the food, watch out your activities. And if your food and your activities balances your calorie expenditure or calorie intake, then you are going to stay at normal weight. And again, another thing is that we need to be very conscious,
Yes.
Each decade of life we pass, we require at least 200 kilocalorie less amount of food. The food that you were eating in your 20s, if you eat the same amount of food in your 40s, you're bound to gain weight.
Exactly.
And if you're going to eat the same amount of food in your 60s, you're going to gain even more amount of weight.
Yeah, the body metabolism also slows
metabolic
down.
rate slows down as you age.
And so talking about myths, like what are the myths that you come across about thyroid especially, that people have in their mind?
Yeah, people have in their mind thyroid. Some people think thyroid is infectious. Some people think that if girls with hypothyroidism, if they get married into a family, they won't be able to bear a child.
Yeah.
So this kind of myths
That's a
do
social
come
stigma.
up.
I mean,
There's a lot of social stigma that if you take thyroid medication, that you're not going to be able to have a child.
Then about food also, no? Broccoli.
Food also, there are a lot of myths about food, that cauliflowers, broccoli, cabbage, soybeans, that if you have got a thyroid condition, you are not going to take
salt
this.
Intake, yeah.
Salt intake also. These food, they're called goitrogenous food. If you're going to consume these kind of food in large amounts, quantities, it's going to affect your thyroid function. But if you're going to consume in limited quantities, and also leaving few hours gap after taking a thyroid medication, usually doesn't cause a lot of problems.
Yeah, you just have to eat like a human for that.
You have to eat normally, yes.
All right. So to conclude today's episode, like one important message that you would like to give to our viewers regarding thyroid function and its connection with obesity, and what are the necessary steps that they really need to take?
Okay, thyroid functions, we have already discussed about your thyroid function, and what does your thyroid do. If you tend to gain a little bit of weight, feel very tired, someone in the family, your near relatives like your mother, father, or the siblings like brother and sister have thyroid dysfunction, do a thyroid function test, and if there are problems in it, go and visit your doctor and get started on medicine. Alongside with it, if you are on the overweight side or obese, do pay attention to your diet and to the exercise regime, because if you're mindful about it, you will definitely be able to lose weight.
So thank you so much for joining us today, and it was like a wonderful episode today. Thanks a lot for being here today.
Thank you. Thanks a lot for inviting.
So for all our viewers, आज के episode से हमने ये जाना that your thyroid could be the missing piece of the puzzle. So please understand that diagnosis matters, medication helps, but lifestyle changes makes all the difference. So if you find our videos informative, don't forget to subscribe to our channel and follow us on Instagram at Mankind Specialities for more such valuable health discussions on various health topics. Until then, stay informed, stay healthy.